Hello and welcome to the Hans Moore YouTube channel. I am Hans Moore and today is 13 days post-op of my facelift, neck lift, and lower eyelid surgeries, which I underwent all three procedures in the same day, and it took 4 hours for the surgery. I was awake the entire time. Dr. Harris gave me 2 Xanax before the surgery. Then he injected me with a local anesthesia all around my neck and my face and under my eyelids. He worked on my eyelids first, and when he finished with the lower blepharoplasty eyelid surgery, then he moved into performing the neck and the facelift at the that procedure. And then what he did, he just used a local anesthetic. It's a light method of sedation that prevents the brain from receiving any pain responses. And what the local anesthetic is, it's what's it called? I got a little note here. Oh, it's lidocaine. It's a numbing agent mixed with epinephrine. And epinephrine is a blood vessel constrictor. So the local anesthetic was lidocaine, a numbing agent, and epinephrine mixed together, which is a blood vessel constrictor. And this is injected into the skin, so you're awake the entire time. You're in full consciousness. You know what's going on while you're having this performed. Also, the numbing effect takes place within 15 minutes and lasts for 2 hours. And so during the process, he will continue to inject you with the local lidocaine. Now, I'm going to go ahead and take this off. I have been wearing this. Again, this is 13 days post-op. I've got long hair, so I use these little pins to keep all the small hairs from flying into my face. And it also keeps this thing, when it's connected to the hair, from sliding while you're sleeping. I have to wear this compression Velcro bandage for 8 weeks. I wear it all day long. I sleep in it. I've got different ones. I've got another one here. These look very medicinal, and you can wash them. Now, on the side of my head, like, what is this? Well, the bandage, the compression bandage, was starting to hurt my ears because there's stitches here. Let's look up here. There's stitches here, all the way back here, and going back for the neck lift. These are little sponges that come in a pack for makeup. Well, it was hurt. The compression bandage was hurting my ears, making them so tender. I just took these little wedges that were not cross-contaminated with makeup. They were brand new out of the bag, and I used them to put under here when the compression bandage kept bothering my ears, and I slept in them. There's one on each side. Also, I have found I've been sleeping on my back. You have to sleep like that, but now I'm kind of sleeping on the side. There's no pain. But I also found that these sponges, they're makeup sponges. You can buy a whole bunch of these in a bag. I have found putting these under the compression bandage would help me relieve any stress from the compression where it's constantly compressed. Now, when you have a neck lift, you have to wear this compression bandage for 8 weeks because you want all that skin to adhere back to the bone, because he's going to be removing, when you have a facelift and a neck lift, he's removing deep fascia from the bone and from the bones down here, and you have to adhere it back even though you have all your stitches. And in order to adhere it back, you need to wear this compression for weeks. Okay, So there are a few things I want to talk about. First of all, I want to talk about my bruising. I want to look real close here. Again, this is 13 days post-op of my surgery, of the eyelid surgery, and you can see right here, there's sutures right there where I had fat pads removed and they come out to here. These are dissolvable sutures. In 5 days, I will go out to the doctor to do my follow-up. That will be 3 weeks and 5 days. In 5 days, it will be 3 weeks post-op. He's going to make sure all the sutures are removed, even though they are dissolvable. But this is the bruising I have after a lower blepharoplasty, 13 days post-op. So it's yellow here, a little swelling, not a lot of swelling. And then you've got this little bruising up here and here. And I use a cover up. I put makeup on this part, but I do not put makeup on the sutures. And then I just put on some sunglasses if I want to go out in public. And yes, you have to wear the bandages. Also, I want to talk about the sensation. When I had the neck lift and all in the facelift, it was numb. So the first 10 days, the numbness was slowly coming back. And now I can feel this on both sides. I can feel that. I can feel everything. Now this is still a little numb right there. Let me see if I can get this to open up a little bit more. Yeah, I want to try to get as much in here. So this is still a little numb here, but there's sensation coming back. That means no serious nerves were damaged. This is still a little numb right here. This is still numb, but I feel all this. So no serious nerve. My nerves are waking up. I'm starting to feel on fire. You can feel the neurotransmitters kind of going, kind of waking up, and it gives you a jolt. It doesn't really hurt that much. So I also want to talk about the compression bandage. Again, you want to wear that as long as possible, even though these are pretty ugly. These are ugly. These are fine for wearing around the house, but they sell a whole bunch of different kind of compression bandages on Amazon. And that's what they're called, facial compression bandages. And they're designer looking. They stay on your head. They're very ergonomic. They're stylish. I've ordered, I think, 3 or 4 pair of different kinds. I'm going to show you. They'll be arriving in 3 days because you have to wear these bandages for 8 weeks if you're having a neck lift in a facelift. And if you do have a neck lift, you have to have a facelift, normally, in my opinion, because he's got to lift all this up and pull it here. So you can have a facelift without a neck lift. But when you have a neck lift, everything's got to go up. So normally they're in conjunction. You can have a lower blepharoplasty and upper eyelid plasty on the same day, but you don't have to wear compressions, bandages at all. So now, what else I want to talk about? You can follow all these videos. This is like, I don't know how many videos I've got from day one. 6 hours post-operative, I have been filming every single day. Go to my YouTube channel here and look at my playlist for male facelift, and you can follow all the videos. Just click on those, or go to my channel. But I do have all these under a playlist. All right, let me go in here. I had a lot to say. We're trying to look at the sutures. Let me comb back my hair a little bit so I can show the sutures. I'm 57 years old. My neck was sagging, and I had puffy bags under my eyes, It wouldn't go away. It was not nothing you can do about it. There was nothing you could do about it. You accept it or you get on with life and let it be what it wants. But I have been working in some movies, in some low independent movies, doing acting and casting and some directing, and I just thought, I want to look good. I might be in another movie because we've talked about that. So, you don't have to be in a movie. You don't have to be a commercial person. If you just want to do plastic surgery and you want to feel good about yourself, you're allowed to age. If you want to age gracefully and be old and look old and embrace what the nature of life is, it's wonderful. It's great. But for certain things, sometimes certain things bother you. You might want to go get veneers and your teeth bleached and have your teeth worked on. It's cosmetic. It represents who you are as being a person. If you want to improve, you go to the gym, you want to lose weight, you want to be healthy, you want to look good in your clothes. I dye my hair. I have gray hair at 57. Look. So I'm just telling you, I'm not 21 anymore. So I've got gray hair and I have to dye my hair. And I do like long hair. So normally I'd wear my hair like this. But I could go out in public and hide the scars right there. I could hide them. Put on some glasses. But I don't go out in public at all unless I have my compression on. And I've got a smaller one as well. And then I wear a hat and I'm in disguise. But, okay. Let me see if I can show you the sutures. I just want to show you the sutures before this video is over. And I found it much easier when you're recovering from cosmetic surgery to have a straw. After I had my neck lift and facelift and my mouth and everything was compressed, I find it easier just to use a straw so it doesn't spill all over you. And I was kind of numb the first few days. So my pain level today is I really don't have any pain. Not much at all, but I'm on ibuprofen now. You don't want to take ibuprofen in the very beginning because it thins your blood and you don't want to be a bleeder, but it's now 13 days post-op. I came off the acetaminophen, which was Tylenol, and then I just started taking the ibuprofen, and I feel fine. That's all I'm taking. And I was on prednisone for 5 days to help with the swelling, and I was on antibiotics. And for 4 days, I was on Percocets, and I was just chopping them up. I was just chopping them up and using them throughout the day for pain. And there was some pain involved. It's irritation. Okay, let's see. What I want to show you here, I've got to set up all my mirrors. I want to show you how I'm healing with the sutures. You see back there? Those are sutures. And there's not a lot. There's some bruising up here. The sutures go here, here, all the way back. But 13 days later, you see, they're not inflamed. They're healing well. I do not see any issues. Sutures come all the way back here for a neck lift. All the way down there. In here, and here, and here. And that pulled my neck up. I had the little banding, like my neck was sagging, and I had these bands, these long bands that would come down. And it was called banding. Irritated me. Sometimes when I think about plastic or cosmetic surgery is you tend to age more in your eyes. So if your eyes are bothering you, if you have saggy eyes or lower eyelids that are sagging down or anything, I think the first kind of cosmetic surgery I would do is for the eye area, because I think that's where you age at the most. Anyways, well, I appreciate you watching this video. It's very long, and I hope it was informative, and I'm giving you some truthful information that you can actually use. Go back and watch day 1 all the way up to 13 days. I'm trying to document it as much as possible. I'm talking a lot. I'm in a good mood. I'm going to go out today in public. I'm going to wear a hat, and I'm going to wear my small compression bandage. I'm going to put on my glasses, and I'm going to go out in public looking like just a normal person. Now, even though I do a lot of characters, I have gone out in public as characters while I was healing from this cosmetic surgery, because it makes me feel good. Therapeutically, dressing up in all the characters and going out in public when I'm healing, nobody knew. It was just something I wanted to do, to have fun with it, and to distract me from any of the pain, or that knowing that I had 3 more weeks to get the stitches out, or I have 8 weeks to wear all this. To not worry, I would dress up in all my costumes to go out in public, and nobody knew that I was in recovery post-operatively. So thank you for watching my video. I hope it's very helpful. Again, I'm 57 years old. I got to keep my hair long for a little bit longer. I've got 2 more scenes to finish in an independent film that a friend of mine wrote, and I helped direct a little bit and write. But anyways, thank you all for watching, and give me a like, subscribe, and watch my playlist. And have a wonderful day. And happy 4th of July, which is tomorrow, 2024. Bye-bye.